its members, nor PBS El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. All of us here on this table are hoping that during this COVID time and more people working at home and social distancing, that at least you're getting outside and getting some exercise while social distancing. And that's today's program. We're going to talk about that exercise that we're still doing. There are still achy joints and things that may not move as well as we're getting a little bit older. So I personally in my neighborhood see people on bike rides all the time. I see them running and walking, and it's just a joy to see everybody outside. But again, for those of us that are aging, it's like, oh, that's a little stiff and this joint's a little stiff and I may have hit something wrong on my ankle. The name of this program is Advancing and Addressing Joint Pain During COVID-19. Yes, we are in a pandemic, but if you are hurt, if there's something wrong, there are still definitely places to go to safely to address those issues. And that's very, very important for the public to know. There's new technology that's being discovered every day about joints. That hasn't stopped since the pandemic. It's certainly making quality of life for many, many people much, much better. And again, if you're feeling some of these things, you can still find out how to be treated. We're going to touch base also on arthritis and how that affects the joints and some current management strategies to make all of our lives a little bit more comfortable as we're trying to move around a little bit more. During this next hour, we have experts answering your questions about joint pain. And as you know, this is a live program. So give us a call at 881-6013. We're going to receive your questions through text, and 881-6013. Sorry, 0013. There, that's what it was. I knew there was something funny about the phone number. Thank you. So once again, 881-0013. How long have I been doing this show? My goodness. This evening's program is underwritten by Tenet Healthcare. You may know them as the Hospitals of Providence. We also want to thank the Texas Tech Paul L. Foster School of Medicine for providing some medical students here this evening to help man our phones. Today we have Kristen Helmsdorfer with us, and we also have Melissa Huddleston. So when you call in, those will be the two students that will be answering the phone and sending texts my way to get those answered. We also want to give a big thank you to the El Paso County Medical Society, who's been doing this show for 23 years now, and all those doctors who sponsor and support this show each and every month. I'm Catherine Berg, and you're watching the El Paso Physician. I have a doctor here giving gang signs to the other doctor while they're on air. It's like, hey, 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 hey. We'll figure out what those are too, right? In just a little bit. I've got a veteran here on the show, one of my favorite docs to interview, Dr. Luis Urea. And I asked him, he is a second, but he's not a junior. Because, you know, when you're a junior, you're just a junior. So he's Dr. Urea the second. He's in orthopedic surgery, and he specializes in sports medicine. And then we have Dr. Zach Lovato, who's also an orthopedic surgeon and specializes in spine surgery. So we're going to have all those things that crick and crack and, you know, exercising a little bit, which is good. Keep doing that. That's very important. Again, the medical students, we have Kristen and Melissa here. And what I'd like to do is start with Dr. Urea. We have you on usually a month from now, often in the years past, because we're talking about sports medicine and kids starting football and basketball and this and that and the other. But what are you finding yourself doing all day, every day, at least now? And your fall is going to look a lot different than it usually does. But just explain to the people at home what your specialty is and how it may be changing or has changed in the last couple of months.
Okay. Well, as an orthopedic surgeon, what we do is we take care of your muscle, your ligament, your joint pain. Anything from the top of your head down to your big toe. And some of us, like Dr. Lovato, is a specialist in the spine, and he did a fellowship in spine surgery, and I did one in sports and knee and shoulder. What we do is we focus on trying to figure out what may be causing pain, discomfort, inability to move or do what you like to do. And through, many different treatments, starting with, we try to do things that are simple and non-operative. And then, of course, there's things that we need to take care operative, like what you earlier in the show here, you're talking about joint pain and things of that sort. Mm-hmm. So as an orthopedic, as a sports a physician, I take care in the summer. A lot of people, they're weekend warriors. And during the pandemic, certainly it's become more than a weekend because a lot of us have more time to work out. We have the heat to worry about, but things, people still continue to do things and try to stay healthy, which is going to help your cardiovascular as well as your joints. But we have to modify depending on what problems we may have. And this fall, we're going to see what happens, whether we have school. Certainly, one of the big sport that there is a lot of injuries in is football. And so we'll have to see what happens. I know that UTEP is working on practice right now, and the universities are trying to see if we can go on forward with this, and we'll see what happens in high school. So if not, we'll just continue to take care of everybody, the people basically my age who are trying to do a lot and sometimes hurt ourselves.
That would be me. If anybody can do a close-up on my ankles, I'm riding bikes every night, and there's something about one pedal that just keeps, I've got these bruises, but it's not a joint thing. But anyway, it's fun because we do get to see people across the street, but I feel like really and truly there's, tenfold more people outside than there have been before. And I think that's great, and we want to encourage that to continue to be the case. I'm going to throw out a number and a website, and I'm going to do that several times during the show. But if you want to get in contact with these docs or this group of doctors, the website would be, and it's a lot of just spelling it out, website is www.elpasoorthopedicsurgerygroup.com, and the phone number is 915-533-7465. So, Dr. Lovato, let's talk to you about the same thing. So, spine. Not so much, I think that I feel like Dr. Urea is very involved with, the college and high school sports. Is that kind of your role too, or is it mainly people who are just having issues with their back? I will raise my hand. Right behind me, you can see some hip bones and a spine area back there, and Dr. Lovato was kind of joking because it's crooked. He says, yeah, somebody gave it scoliosis. That would be me. That's my spine. So I'm nice and crooked in my spine. I feel like so many people have back issues. And especially, it's almost the opposite of what we were talking about, Dr. Urea. Some people are just sitting at home on a bad chair because it's not their office chair, whether it's the kitchen table or the kitchen counter, all day long working from home on their computers. So there's a lot of back issues there as well in the spine. And then maybe we can talk about some spine injuries. But what do you do all day, every day, and how is it different right now during this time?
I would say, so as far as day in and day out, I see patients of all ages. I'll take care of children even with scoliosis, or maybe that don't even have scoliosis that have occasional aches and pains. But I do subspecialize in spine, so it's usually neck, upper back, or lower back problems, which could include pinched nerves and things like that. And we will occasionally get the patient, even who's very young and may walk in with a herniated disc and a pinched nerve, and kind of treat them along the same spectrum. But I would definitely say the bulk of my patients tend to be more degenerative changes, so kind of aging problems. So I definitely see more on that upper end of the age spectrum, but I take care of both in and out every day. I'll see some of both. As far as changes now with the COVID-19, it's really hasn't changed my practice other than slowing it down. There's definitely, I think, probably a little bit fewer people coming in just because people aren't trying to get in to the offices and much and things like that. But I'm still seeing kind of along the same spectrum. But yeah, I'll treat both cervical, upper back, and lumbar problems.
Okay. Dr. Urea, I'd like to kind of piggyback on what Dr. Lovato was saying. And again, we're addressing people at home. And we are addressing people like, we are having spikes of COVID all over the place, especially in El Paso. And the comfort level, I would like for you to kind of walk somebody through going to see you so that there is a comfort level of this is what we have in place to make sure that you're okay, taking temperatures, everybody's got their masks on, social distancing, so that people at home can feel comfortable. It's like, my knee has really been bothering me for a month, but I don't want to go in because... Talk to me about how you're talking to people about coming in. I'm saying that right. You know what I'm talking about.
Sure.
Right?
Well,
okay.
I think our office, like all the different Providence Medical Partners offices have done, is we follow the guidelines of the CDC and also following our orders from our city and county health department. And taking all the basic precautions. First and foremost, before entering our office, we have a station where you're going to have your temperature. We know that's important because anybody with a temperature certainly could be actively infected. We have a questionnaire that at the beginning what the CDC had was basically 4 questions. Now it's up to 12, I believe it is now, including asking you, have you had any travel, it used to be in the cruise ship, now we want to know if you've traveled anywhere outside of El Paso.
Right.
Have you had any exposure to somebody with a COVID patient? Have you been tested? And it's really important because some people, we want to make sure to protect our patients who walk in the office as well as our staff. So once you've passed that, you're going to come in, you're going to check. We've got a 6-foot distancing from all our staff so you can check in. You'll be sitting, we've opened up or decreased the capacity of people sitting. They're all at least 6 feet away. And of course, in order to do that, we've had to decrease the number of visits we can have at any one given time.
Right.
And you've got hand cleansers to use when you walk in. If you happen to have gloves, we're going to ask for we'll give you new gloves because you don't know whether you've contaminated those or not. At all times, everybody needs to wear their masks. Our staff, including the doctors, we're going to be wearing our mask. We're going to wear some kind of eye protection. And it's hard within a clinical setting to always be 6 feet apart, especially in an examining room, but we do our best to stay as far as possible. Minimize the number. Also, we minimize who can come into the office. The patient can, unless you have a problem with mobility, or if you're an underage, or if it's your mother or father who needs a lot of help. But otherwise, we need to minimize our interactions. And then we take those precautions from the front and the back. And that's really the best that anybody can do. At night we have an incredible cleaning crew taking care of everything. During the day, after each examining room is used, it gets wiped completely clean, sprayed. So we try to minimize our contact, distance ourselves. The key is us wearing a mask is to protect you and anybody else around us, and if we all do that, we certainly have learned that it does make a big difference. So.
Exactly. And you swam right through that beautifully. So that was the point that we're trying to make, that last time we were on the air, we had the ER docs on, and there's a different path that people are taking into the hospital. There's the COVID area and then the non-COVID area. So there really are standards set into place to make sure that you are safe when you go in for a non-COVID related issue. Again, the idea here is that we all still have our medical problems, even though COVID is still going on. And we want to make sure people feel safe to take care of that and go visit the docs that they need to visit to have that taken care of. Dr. Lovato, let's talk a little bit about you. So we've talked about COVID. I just want to set that aside for a little while because now we're talking about the stuff that we've been dealing with all of our lives. I'm a scoliosis girl. I have that curve right at the bottom of my spine. My left side of my body is just a mess. Talk to us about when people feel like, what are some symptoms that you hear from patients where you're like, you know what, I'm glad you're finally here. You should have come here a year or two ago. What are some of those symptoms that people come to you with regarding the spine?
So it can be, any pain anywhere along the spine, right? Things that are a little bit more concerning or would be something like actually more pain into the arms or legs, which can be a sign of pinched nerves, right? So pressure on the spinal cord or spinal nerves can be more of a concerning symptom than actual true back pain or neck pain. Back pain and neck pain in general can be caused by many different types of issues, right? It can be due to muscle problems, ligament problems, tendon problems, not necessarily actually the true structure of the spine itself. But another big source of back pain, especially in patients with more advanced age, could easily be fractures. I see fractures in and out every day. Most commonly, they're not the dangerous type of fractures that you get maybe in, say, a car crash or a significant fall. But you know, patients with advanced age and relatively poor bone quality can sustain fractures very easily. I've had patients who have fractured and sustained vertebral compression fractures just sneezing. I've had some patients get fractures they don't even know how, right?
Right.
So, you know, significant amount of pain, changes in the pain, or radiating arm or leg pain along with radiating numbness and tingling and things like that could be a little bit more concerning symptoms.
Okay.
But I think at
And
any
that would
point,
radiate like from the neck area?
usually,
How to
yeah, it will.
describe-
Usually,
okay.
it will start. Usually, when you're talking a possible pinched nerve in the neck, usually we'll talk about neck pain that kind of radiates into a shoulder and down the arm, usually to the
Gotcha.
fingertips. Sometimes it doesn't have to go quite to the fingertips. Same thing with the back, right? It'll be pain that starts in the back, goes to the buttock, goes into the thigh in some region, and down into the lower leg. So those are very common things. Not necessarily a scary or dangerous condition,
Right.
but definitely can be a sign of more than just a muscle or ligament problem. Can be a sign
Exactly.
of a compression of a nerve or the spinal cord itself.
Okay. And when people come to you, what would you say is the most common ailment that you get with the spine?
You know, I would.
know it's a lot.
Yeah, but
Yeah.
no, I think that's a good question. I think that probably the bulk of what I get is usually a pinched nerve.
Okay.
I see plenty of people with just, you know, lumbar sprains, or, you know, just someone threw out their back, or, you know, threw out their neck. I see that very commonly. I agree, but a lot of the time, by the time the patients are getting to me, it usually means that something has persisted for quite some time, right? I don't get a lot of people in my office that are like, "Oh, I hurt myself last week." No, I will.
Right,
I'll
right.
get some people very quickly or early on in their course. But a lot of what I'm getting is I get referrals for people who've had pain for years, right?
Right, exactly.
And a lot of these long-standing symptoms of pain, especially when we're talking, you know, symptoms into the arms or legs coupled with the back or neck, are usually more of a sign of, you know, maybe you do have something more significant on the disease spectrum, and it's not just a pulled muscle, right? In general, whenever you're talking about soft tissue injury to the muscles, ligaments, or tendons, or, you know, you threw out your back, usually that's something that can get better a lot of times with time. But seeing a physician like me or any other specialist, or even a general orthopedic doc, can get you on the track of, you know, easy stuff like oral anti-inflammatories, physical therapy, things like that. But a lot of times these things will also resolve with time. Longer standing symptoms would be something that I would be more you know, willing to say, hey, you should probably get checked out.
Right, exactly. And you said at the beginning of the show, because that's something that we promised too when we did the opening, is that you see the most common is like pinched nerves. Is that something that works itself out? Is there manipulation there? Is that something that, I know you have a beautiful spine here, but talk about pinched nerves for a second and the treatment for that. And then, because then we're going to go to all of your toys. But does
Gotcha.
that make sense? So pinched nerve, because I feel like I do have neck issues. I have all kinds of issues. It's fine, but thankfully everything's benign. But yeah, there's that specific nerve pain that you get. It's like that shooting pain. What is it that people can do about that?
There's a lot of treatments that can be done with that. And interestingly, your treatments for just injury to the ligaments, tendons, muscles in the back, your treatments are actually starting the same, right? We start off with conservative treatment, which would mean if you have healthy liver, stomach, and kidneys, and are healthy enough to take anti-inflammatories, we usually start up with anti-inflammatory, but obviously if you're seeing a physician, we'll put you on a prescription strength anti-inflammatory. Physical therapy is a gold standard. Anti-inflammatories are a gold standard. You know, depending on what the real problem is, you know, sometimes we'll throw some muscle relaxers in there, especially if you're having muscle spasm. But that's kind of the gold standard of treatment in general for these problems, whether it be soft tissue related or pinched nerve related. Now, should you not get better with the conservative treatment over a period of time that is deemed adequate, our next move would probably be to go get an MRI on you, right? So x-rays themselves, what we can get in and out of our office, are better for showing us the bony quality or maybe some severe degenerative disc disease or some arthritic changes in the spine, but they don't necessarily show us the nerves themselves. We can make assumptions on them based on what we see, but not true. We can't identify true compression, usually without an MRI. So an MRI in my type of practice as a spine specialist is kind of a gold standard for persistent symptoms. And, you know, maybe we'll be a little bit more enthusiastic about getting an MRI sooner if you do have those symptoms that are very consistent with the pinched nerve. But should you go from there and an MRI confirm stenosis, or stenosis just fancy word for pressure on a nerve or spinal cord, you know, our next step would be, well, we could consider, you know, all those treatments that we already discussed, or consider epidural steroid injections. Surgery may be an option depending on how severe the stenosis or pressure on the nerve is, but as long as nothing dangerous or scary is going on, we try obviously the more benign treatments, but that could range up to surgery.
Right. And again, you beautifully went through the entire gamut, so I love that you did that. So we're gonna go over to, I keep thinking sports injuries, but right now it's just a matter of getting outside and moving around injuries. So we have a couple of knees here and a shoulder.
Knees,
is that right?
Yeah.
So what I'd like for you to do, Dr. Urea, is which camera? Will it be this camera here? That he can point these to?
Well, to both cameras.
Okay, excellent. So if you can kind of show us what most common injuries are with the knees.
Okay.
Because I feel like, yeah, anyway.
Well, we'll start with the knee.
Okay.
And so in the front of the knee, you've got the kneecap with your quadriceps and patellar tendon. And if you've done a lot of jumping or running, you can end up with a tendonitis, which is just an irritation of the top or bottom tendons that attach your thigh muscle to your lower leg. Once we reach the now we're looking inside the knee, and the top bone called the femur and the bottom bone called the tibia, they articulate or they move with each other on this, and it's usually a white structure, but in here it's a blue color, and that cartilage, if it's in good condition, has the least amount of friction of any surface we have on Earth. It's incredible.
Any surface we have on Earth.
Anything, there's nothing we've invented that has less. If it's a good cartilage, it's fantastic. And then in between your two bones are the menisci, and these are these C-shaped wedges on your knee, which serve to stabilize the knee, give shock absorption, and distribute the forces of the top bone on the bottom bone.
Okay.
So, and then the ligaments, of course, but in sports, and the ligaments are what attaches the top to the bottom bone, and there's the inside, outside, medial, lateral, and the cruciate ligaments. So the common things we have when we're doing activities is you can irritate the lining of called synovitis of the joint that can cause pain and swelling. We worry that some cartilage damage might occur if you've had a twisting injury or been hit or taken a blow. And then if you knock a piece of cartilage, of course, that's like having a small pebble in your shoe. Doesn't do very good in the knee, scrape a lot of things, so we have to do something to take that out. And then at the same time, if, depending on how deep that injury is, we may have to do something to stimulate healing.
Gotcha.
A lot of times we can just clean it out. The menisci are probably the most common things that are torn, especially as we reach to our 30s and 40s. The menisci do degenerate with time, although a lot of people live 100 years without any problem. But if you have a little degeneration, or if you have the right injury, you know, some people say, how did this happen? I've played tennis, I've gone for that shot a million times. Why? Who knows? It's just a unique time and force that occurred, and you might tear your meniscus. Once the meniscus tears, menisci never heal.
That's the important part.
They never heal.
Right.
So when if, depending on where it's torn, there's 3 zones we like to talk about. But basically, the farther out in the periphery that has the most blood supply is the one that we can repair. That is usually somebody under 30. Not too long ago, I had a 54-year-old that had a 20-year-old tear that we repaired. Most of them, though, as we get older, are in the white zone, in the non-vascular zone, avascular zone, and that one is the one we clean out. And it's very important, I think, what we talked about is, as we're younger, in our 30s or below, your MRI is usually going to be fairly normal. But as we age, a lot of things degenerate in the knee. And not all tears, especially menisci, we get in our 50s, 60s, and really more 70s and 80s, ever need to be addressed unless it's a traumatic injury. But if it's a wear and tear, most of the time we can take care of that without having to ever do surgery. So an MRI is very important, especially for the spine, because there's the nerves are something we need to protect so we don't lose strength, and of course the pain that's created. But most things in the knee or shoulder, as we reach our 50s, 60s, you'll have a lot of degenerative changes, which if I took 100 people and got an MRI of their shoulder and knee with the complaints you have, I can get the same MRI in somebody who's never had any problems. So it's very important to really ascertain your history, your exam, put that together in MRI and make sure that makes why you hurt. And if it's not traumatic, again, we can take care of many things with therapy, medications, and that so on and so forth.
And I love, and just on the programs we've been on before, there's a point where, and I was talking with Dr. Lovato too, there's a point where we waited too long, or like, why did we wait 4 years to do this? And that's something too, we were talking about the knee, I know there's shoulders, there's all kinds of things. When, and this is again a question for the audience, and it's hard to describe, and I almost feel bad about asking you this, but when is it bad enough to come in and see you? And I guess that's the question, and you may have had patients like, yeah, this has been bothering me for 3 years, and you're like, why did you come in? What's the answer they usually give you at that point?
Well, it's across the spectrum, you know, and the truth is, pain is something that only you can describe for yourself.
Right.
The things you really need to worry about is if you have constant pain, especially pain at night. We always worry of something like a tumor.
Oh, interesting.
Especially
Right.
once we reach our 50s or older, that becomes something. Now, if you already know that you have some arthritis and you always have that ache, that's something that you will learn, and then something changes from that, a change in that pain pattern certainly should be seen. As far as what pain, you know, if you've never had any pain and you develop something that keeps you from doing your activity, keeps you from working or doing something that without the pain, I think that should be seen. If you have you know, every time you walk a mile or more, your knee hurts,
Right.
and it's on the inside and it's the same pain you've ever had, you know, that's something you have to work through.
Yeah.
And if you've tried the simple things and you're not better, yeah, please come in. But
Right.
I think
When it starts impeding with your normal
I think
activities,
it's
right?
activity related. If you can't do
Okay.
what you want to do, that's when you should be looked at.
Okay. And that's nicely said too. We're starting to get questions here from the audience. This is a hip question. I know we haven't talked about hips yet. However, I love when you give me the age and the sex of the people. Thank you. Way to go, Melissa and Michelle over there. Female 52 fell 1 year ago on the left side of her hip and is wondering if she could have fractured her hip. So this is a year ago. What signs should she be looking for? And what would indicate a fracture? There is a lot of pain in the hip when walking. Would taking calcium or magnesium help heal the bone? Dr. Urea, should she come in? I would say yeah, right?
I would definitely say yes.
Okay, come in.
Yeah, certainly at a year, the chances you had a fracture, a significant fracture, I would not worry about.
Okay.
The question is there some arthritis? Did you knock a piece of cartilage off inside your joint? Or more likely, did you tear one of the tendons around the hip? Because the hip is very similar to the shoulder, and it does have tendons that move it.
Exactly.
And this one thing, I think bone health is very important since we're here on the orthopedic surgeons. It's very important that, you know, especially women during right after menopause or during those years, that they get checked with their PCP about their state of bone health, doing with a bone density study. Because if you can treat early any bone loss, you can change the entire strength of your body.
Yeah.
And bone is a living tissue that people forget. So it's very important. And when she talked about calcium, magnesium, and vitamin D, those are the building blocks of our bone. So if it doesn't hurt to take a calcium and vitamin D, you have to take both. Vitamin D helps absorb it, otherwise it goes one end and the other. And then when I went to med school a few years ago, we were told that we're going to learn about vitamin D deficiency, but you don't have to worry about it when it's in the south. Well, we've learned over the last 20 years that certainly our rate of vitamin D deficiency is as low as up in the north. And why? Because when it's hot, what do people do? They stay indoors.
Go inside.
Or our sun lotions or sunblock are so good that we're not getting the enough sunlight to convert your vitamin D. So it's very important to take those vitamins. There's nothing wrong with it. Calcium, vitamin D, And always get that checked every once in a while with your PCP to keep your bones in good shape.
Yeah, I completely agree with you on that. Dr. Lovato, this is a follow-up question to what we were talking about just a few moments ago. This is a question from the audience. What can someone do to help out with pinched nerves beside just medication? And she's saying including shots. So this is, or he, it's a 47-year-old male, so still somebody that's young, but it seems like he knows he's got pinched nerves. Exercises, you were talking about physical therapy. It's a broad question, I
Sure.
know, but how would you address
so
that?
other than shots, so meaning they don't want to get as aggressive as doing shots, physical therapy would be kind of one of the, like I said, I would include in the gold standards. But there's not just one type of medication as well for this nerve pain. Like I spoke about, there's anti-inflammatories, that's kind of a gold standard. There's also some nerve pain medications. Now, that doesn't necessarily fix the nerve or unpinch the nerve. And physical therapy also doesn't necessarily unpinch the nerve. But a lot of times whenever people herniate a disc, a lot of that reaction that they may get, especially quickly on, is actually from inflammatory reaction from material that's released from the disc. And it can be highly inflammatory and cause a lot of nerve pain. So time is one of those things that I would also add is a treatment for these. I mean, it really is. A lot of times these can get better with time, and that's why, as me and Dr. Urea said, sometimes these long-standing symptoms are something worthwhile checking out because maybe it's not something simple. But yeah, my answer to that would be the most researched and studied treatments that we have for this, other than the things that he mentioned, I would say is physical therapy. Seeing a formal physical therapist who specializes in these things. We have many good physical therapists in this town, and many of them are very focused and are well trained in the spine, including McKinsey method and things such as that. And so that would be, like I said, I put on the gold standard, and unless someone comes in with a dangerous or concerning condition, we always start there.
Okay. I have another question here from the audience. It's not necessarily a medical question per se for doctors, but I do want to honor it. The question is, do patients need insurance to come see the physicians group, or can they just walk in? And so I will say, because I know that's not your area, but yes, you can walk in, but then there's a cash price and there's an insurance price. I'll just throw that out there because we don't want to keep anybody away if you don't have insurance. That's the point.
No.
So I just wanted to throw that out there. Question here for Dr. Urea. It's kind of jointy, but 59-year-old woman called in. She wants to know about trigger finger. So let's just talk about hand issues. I know we're on computers all the time. I know I'm feeling weirdness in my forearms because you're texting all the time now or using your phone for work. But in general, she's asking about joints in the hands, trigger finger for her specifically, and what can she do to help that? Are there exercises that she can do? Are there foods to avoid? She also is wondering if it's arthritis. So that's a lot to throw in there, but just in general.
Well, in general, trigger finger occurs there. Each finger has two tendons that go one that goes all the way to the tip of your finger, and the other one that goes to the middle finger, middle bone of your finger.
Okay.
Right here, there's a pulley called the A1 pulley, and it fits the two tendons that go there. And they tend sometimes to get irritated, it's a little swollen. They get caught there, and all of a sudden you feel that little trigger where it comes in and out. That could be repetitive trauma. It could be just inflammation. A lot of times it's diabetes, if you don't have it well controlled, causes increased inflammation in any of your joints or any of your tendons and can cause this. So if you're a diabetic, it's important to get that well controlled.
Right.
So can it be arthritis? Well, arthritis causes pain in any of these joints and the stiffness, but you never get that triggering where it gets caught. So those are two different things. And again, it's resting. If you're doing a lot of activity, whether it's texting, whatever that causes the triggering, slow that down. Icing it, you take your non-steroidals. If those things fail, a simple steroid injection in the A1 pulley usually will resolve that. Every once in a while, somebody has such much inflammation it never gets better. you do what we call a release. And what happens, the pulley gets cut on one side, opens it up, and then gives you the ability to move without triggering, and that works very nicely. And our hand surgeons that do so many of those are very adept, and people right away have complete function.
Yeah, I remember you accompanying Dr. Bell several years ago, and there was a lot to learn from there. Dr. Lovato, another, this is a couple that called in, nice. There's another question here from the audience. I'm going to throw this your way. 75-year-old couple, active and walk regularly, which is nice. How do you differentiate normal aches and pains from ones that need treatment? So it's kind of that same question. However, the 71-year-old female, so she's got pain in the front of her thigh, and then it goes back to the glute region, and she says it brings her to tears. So let's talk about what might be happening in the spine. Her question is, should she go and get care at an ER, at a primary doc? Where should she even start looking? So before you answer, I'm going to go back to that little phone number we had. Think about that. So here is a website to go to, and then we're going to have Dr. Lovato answer your question. The website is, again, www.elpasoorthopedicsurgerygroup.com, all one word. And the telephone number in El Paso, 915-533-7465. So that might be a place to start. So at least we'll answer that question and take it from there.
Yeah, so I would say that the patient should probably get checked out. So I would definitely say if somebody's getting brought to tears, that's not normal aches and pains, right?
Agreed.
Normal aches and pains should be, okay, this is a normal thing, right? It's maybe a very slowly progressive thing, but being brought to tears is not a good thing. And I would say that's not a normal aches and pains. So that immediately would tell me the patient needs to get checked out. She needs to, and go to emergency room. That's kind of a hard question to answer, right? If this has been going on for a month and she's been living with it and still able to walk, there's probably nothing dangerous or scary going on. If this started 6 hours ago and she can't walk and she's miserable and crying, you probably should go to the emergency room and get checked out. As far as what could possibly be going on, it could be a whole plethora of things, and that's why spine surgery, not just surgery itself, but also just the clinical aspect of it can be very difficult. A lot of things can mask as back pain or pinched nerve. She could have horrible hip arthritis that can mask as back pain and radiating leg pain. She could have a SI joint problem, not in the spine, but to the side and lower of the spine that could be causing these symptoms, or it could be a spine problem, it could be a pinched nerve. You know, definitely pain from the buttock that radiates into the thigh could definitely potentially be a pinched nerve or what we call radiculopathy. But also pinched nerves in the lumbar spine usually manifest, unless it's up higher in the lumbar spine like an L2 or L3, they usually cross the knee. So whether or not the shooting pain or numbness and tingling crosses the knee is a big clinical indicator for me of where this may be coming from. But of course, like I said, it could still be an L2 or L3 nerve, but that's much less common than what I see down low at L4, L5, or S1. Those are much more common, like I said, traditionally. They cross the knee. But yeah, so I think that's, I'm happy with that response. No, if it's bringing you to tears, I would not consider that general aches and pains. I definitely think, as they mentioned, their age in their 70s, it's very normal to, at 70-year-old to be having aches and pains, or even, I see plenty of patients in their 80s all day, every day.
Right.
But you should be able to maintain a general well-being, and you should be able to walk. And if the pain is getting so severe that you can't walk, you need to get checked out.
Exactly. And we're seeing more and more centurions, so 80 years old is like the new 40.
Yeah.
Question here, Dr. Urea, and this is something too, we addressed this already, but I love that this person is listening. So question is from the audience, what are your recommendations for a knee replacement surgery? Obviously something that they were thinking about prior to COVID. 62-year-old woman is concerned about coming in even as an outpatient. So this may, and I'm just going to assume, because the disclaimer is we only have what we have. In the old days, I could show the little card, but there's only so many sentences you can read. But that's all we know. So how many replacement surgeries have you been doing during the last couple of months? And again, to try to reassure people that when they need to have stuff done, they still need to have that stuff done. take that any way you'd like
Yeah.
to answer that.
Well, I think certainly pandemics brought new issues that we've never really had to address. And the most important thing is there are situations where they're emergent or urgent to be taken care of. Obviously, if it's life threatening, we have to do that, or if it's limb threatening. And then most of the things we deal with are somewhere in between. Arthritis per se is something chronic. Arthritis didn't occur yesterday.
Right.
And it's something that does progress. And then it becomes, I think the most important thing is an individual assessment and individual decision making with your doctor, patient-centered, to figure out what's best for you. When the pandemic started, you know, we had the stay-home orders. Made us think a lot about what our colleagues had done in Singapore and in other Asian countries, because they had to take care of this. And then, of course, in New York, and we've kind of developed. But one of the things that's very important is who that patient is. If it's somebody younger with no medical problems, just an arthritis, it's certainly your risk of number one, of having a problem with surgery are low. And then if you end up getting infected with the coronavirus, certainly it's not because you had surgery, but we're exposed to new environments, whether it's you're in a supermarket or you go to the hospital. Sometimes, now that with the surge is going up, it's certainly become a little more, there's more people who are sick in the hospital, but I would say that with the precautions being taken care in the hospital, I probably feel a little safer going there than some of the places I need to do to buy food or whatever.
Right.
But that being said, if I have somebody who's younger, so I'd like to create like 3 tiers. And so that first younger, no medical problems, if you feel comfortable, I think it's safe to do so. If you're somebody above 60 with one or no significant risk factor, certainly you are increasing the risk of something bad happening if you got coronavirus. Again, few people who get infected at that age get sick, but is it worthwhile? Does it hurt you enough to take that risk?
Exactly.
And then the most difficult one is our older patient, and in El Paso we have, a lot of the patients that I have to take care of that need joints, they tend to have multiple comorbidities, whether it's diabetes, some coronary disease, hypertension.
Right.
And one of the big ones is certainly being overweight or obese. That has been shown in all the studies that obesity increases your risk of having something bad happen when you have coronavirus at any age group.
Right.
So when I have somebody who's older with those medical problems, your risk is much higher. And then, I want them to really think, is it worthwhile? Is it that bad? And then some people have chosen to do so. But is it that bad now, or do you want to wait? Now, back in April, we weren't sure, and I told people, let's see what hope ends this summer. Well, I think we've come to realize that this is going to be here for a while, a year or two.
Yeah.
And so you have to make that decision. And as the hospitals end up with more and more patients with COVID during the surge, maybe it's a good time for you not to do it. But, but at the same time, we've got ambulatory care centers that don't take care of those sick people we can take care of. And I know all the hospitals have created certain subsections of the hospital, or even a different branch of the hospital, not associated with the main hospital, that we can do that. So the most important thing is to really have that conversation with your doctor, talk to your surgeon, make sure they are understanding what your needs are, what your risks are. We have to work with our colleagues at internal medicine to see how sick somebody is. And if you're very well controlled with comorbidities, you certainly are a great patient. But if you have a lot of comorbidities, or unfortunately, if you're obese or morbidly obese, this is not the time that you should be doing it, in my opinion.
Yeah. Now, I get it, and I hear often, again, just because I'm still working, going into the office a couple of times a week, but mainly from home. But the idea is the world has not stopped. It is definitely modified, and it's different, but it has not stopped. And that's something that we're trying to get across today, that there are issues that all of us have had prior to COVID, and or if you get hurt during COVID, there are ways to get treated that are safe, again, you hit it on the nose when I did this to you. I'm sure the people at home didn't see that, but going anywhere else is less safe than going to a hospital or to a treatment center or to your group, because all precautions are being taken. You guys get it, meaning the medical community. And again, it's science, it's medical. If you have something going on, definitely get it taken care of. Question here from the audience. Oops, I went to the wrong one. So this is, Dr. Lovato, it's not a spine question, but it's just a general question, and I don't know the answer to this. Does red infrared light therapy work for pain? Is it a muscle issue, bone issue, joint issue? Is this something that is a good treatment option? I'm throwing it out there because I want to honor the questions from the audience.
Sure. Be honest, I don't know. I don't know of any studies, at least in our spine literature, which is primarily what I, keep in tune with, that says anything about infrared light being any sort of therapy. So I would say in conventional, medicine, at least how I practice, and as far as I know, no, it doesn't have any role in our day-to-day treatment of these conditions.
Okay, same thing on your end?
Doesn't mean there's nothing cutting edge coming out, but nothing that I am aware in our current literature.
It's certainly not, it's that we know it's not harmful, but certainly there's no data that's peer reviewed that has shown that it makes any difference, but it's certainly not going to hurt you.
You hit a note with me too. Peer-reviewed data is peer, meaning P-E-E-R. I feel like I'm not coming across right. But I want to give out your website again, because there are so many websites that people can go to that just throw out information and freak people out. So if we're talking about orthopedics specifically, because that's what this show is about, a website to go to that is local, and you can ask questions on the site and get information as well. Again, www.elpasoorthopedicsurgerygroup.com. The phone number is 533-7465 with the area code of 915. So a lot of what's happening tonight, if we don't get to your questions, you can definitely call or visit that website for that. And on that note, we're about 12 minutes away from the show wrapping up. It happens fast. So because you're the veteran, you're the second. I almost want to say you're junior because this is your second time here.
I'll take that title.
Yeah, okay. Dr. Urea, again, it goes by so fast. What is it that we want to get across this evening? I'd say the COVID stuff you handle beautifully. I know we've got a shoulder here. Is that a scapula? Can't tell.
That's a scapula with a shoulder. We're just
I know my scapulas. Look at that.
Very good. Very good.
But is there anything that we haven't touched base yet tonight that we want to talk about before the show wraps up?
Well, before I forget, there's the American Academy of Orthopedic Surgery, AAOS, has a incredible patient education website called OrthoInfo.
Okay.
O-R-T-H-O, info, I-N-F-O. .org, and that has anything you can think of. It's peer reviewed, and you can count on that, and it has good references for you to learn. So anything you can think of, it's a wonderful thing if you can't find it on ours.
Okay.
So I want to point that out. I think the most important thing during the pandemic is we still need to take care of each other, and we need to take care of ourselves. Certainly, we want to minimize how much stress we put through the ERs, as they're going to have to take care of, as always, very sick people, but especially now. So you will find that most medical offices like ours are open. You have to call, of course, to make an appointment. It might take a little longer because we don't see as many patients, but it's very doable. Don't wait till things are just terrible to come in, or that makes you want to go to the ER. And there's one of the bridges that we have now. All of a sudden, it was there for a few years, but now we're using this telemedicine.
Exactly.
And our office has telemedicine, and most of your physicians in town are now using telemedicine. And that allows you to have a visit, usually via video, but even if you don't have the capability of technology. And that's one thing we've learned as we went telemedicine, that it's not, if you're a 20 or 30, 40-year-old, no big deal. But as we get older, including myself, it becomes a little harder to figure out how to get on Zoom or whatever it is that we're using. So we can even have a telephone conversation to see if you're worried, if you're high risk. don't have the transportation, so on and so forth, you can use that as a bridge to figure out what to do next. And then lastly, you know, there's from the clinics, don't forget there's urgent care, so you can go to instead of having to go to the emergency room if they're very busy, and the urgent care are for non-emergent things that you may need. I think you know, just sticking with the COVID, it is our responsibility to take care of each other.
Right.
And you know, if we do that, you know, we're going to help, and we'll all get, you know, over this surge, and hopefully we'll protect our most vulnerable, and we'll still continue to you know, do what we need to do. Stay active. It's very important. Just your muscle, your core. If you have knee, hip, or joint, weight-bearing joint pain, non-impact activity is the key.
Right.
Right now it's very easy for swimming. Of course, we don't have open public pools, but if you have the ability to go to a pool, that's great. Bicycling, walking's fine. Avoid downhill because that puts a lot of pressure on the front of your knee. And I like people for now to think about investing in themselves. And how do you do that? Well, if I was a bank and I told you for every dollar you put in the bank, I give you $5 back. With weight reduction, you can decrease for every pound you lose, it's 5 pounds less force to your hip or knee when you move around, or even your ankle. So
every pound you lose.
It's less.
Okay.
So I tell people, look, you lose 10 pounds. Now, is it easy? No.
Right.
But if we had an investment and you can put $1 in to get 5 back, you would do it.
Right.
Do the same thing here. Talk with your PCP, talk to your nutritionist. We have the ability now, since we're not going out to eat as much, use this to then eat well at home. Since you can't go eat well in a restaurant, go eat well, and you can lose, and what a wonderful 10 pounds, 50 pounds less to your hip or knee or your ankle, and that can make a huge difference and prolong the life of your knee before we have to do something about it.
Right. I have such a confession to make right now. I have a 17-year-old son at home, and he loves my cooking. And so I've been cooking. And you know what? Once you cook, you got a lot of food, and you can't just throw it away.
No.
So I joke on my Zoom meetings with people, you know, those of us that are at home, you know, you do some work, you go eat a little. You do some work, you go eat a little. So about a month ago, I was like, yeah, I'm getting a little soft in the middle now, like Paul Simon. But yeah, I get it. This is the time, and that's another reason too. We did the opening statement. We are at home, so we have that time in the mornings and the evenings to go walking and bike riding, etc. So lovely said, and I'm going to give out that information again. The website, orthoinfo, so orthoinfo.org. So anything that we couldn't get to tonight, try to visit that website as well. Dr. Lovato, we've got 5 minutes, which is really forever in the world of TV. So what is it that you would like to speak about this evening before we wrap up?
It's hard to hit it, you know, more on the head than Dr. Urrea just did. I mean, you know, he did an excellent job at covering a whole lot of points that are very important, and not just spine. There's a lot of, you know, crossover there in spine as far as weight loss and things like that. I think Dr. Urrea did a great job in that. If I'm going to have to get on my soapbox, I would say, you know, a couple things that are very important, and I think are even more common in spine are, and one thing that Dr. Urrea touched on earlier was, you know, you can find people who have no symptoms, and guess what? You will find things on their MRI. That's very important, and a lot of people come to me, a lot of patients, and they have an MRI already, right? Well, an MRI, unless you're maybe 12, you're not going to have maybe a full page on your MRI. I think a lot of people will get an MRI and they'll have a report that sounds like the sky is falling down. Well, most likely it's not. You know, everybody has bulging discs for the most part, especially if you're going to be above 30. But what's important to know is just because you have that doesn't necessarily mean that that's where your symptoms are coming from. Right. We can do a study where we can MRI completely non-symptomatic patients, non-symptomatic with no back pain, no leg pain, and we can have plenty of findings on those patients who don't even have symptoms. So the difference is, and what is the hardest part about our job is we have to, and that's why it's important to get examined, get seen by a specialist or get seen by a physician, is that we have to differentiate the difference between problem and a finding.
Right.
A finding means it's something we see on an MRI, but
Right.
it doesn't mean that is actually causing a problem. You don't want to treat a finding because you're really not doing anything, and you could be causing more problems than good. So it's very important, and that's why you need a physician. You can't just go based on what you see on Dr. Google. It's, you need a physician sometimes. Our job is to piece these things together. So that's part of our job, is to find out, is this a finding on an MRI or any advanced imaging, even an x-ray, or is this an actual problem? That's one very common thing I see. And another thing I see is everybody has a friend that has had something, right?
Right.
And everybody says, well, my neighbor has this and this happened to them, so I don't want to do that. Or my neighbor has this and they did great with this treatment and I want to do that. Trust me, you have a lot of levels in your spine, and you can have and each level can cause a slightly different problem. So I think it's very important, especially in what I do, is for people to understand it's not a one-size-fits-all. Nobody's a one-size-fits-all. Everybody's unique. Everybody can have a different pathology, and that's another reason why what we do is important, and it's not just Dr. Google to take care of it. All of our jobs is to try to get people better with conservative measures. We're there for that few percent that maybe needs to go to that surgical route because they're miserable with their symptoms or has something dangerous going on.
Right. I feel like everybody just put everything into a nice bow this evening, so that's fantastically said. I'm going to give out a couple of more information pieces here. If you joined in late or would like to see this program again, if you had some questions or one of the doctors were saying something you didn't quite get at all, this program will air again, or it won't air again. It will air again here and there, but you can access it online at kcostv.org, and you would go to watch and then find the local programs. El Paso Physician will be there. It's also on the El Paso County Medical Society's website, and that website is www.epcms.com. And again, the website that's local, the orthopedic surgery group here, is www.elpasoorthopedicsurgerygroup.com, all spelled out. The phone number, 533-7465. And again, for general information and questions, you said it was a patient teaching device. I like the way you said that. orthoinfo.org. So those are some places that you can go to for more information. I want to say thank you once again to both Kristen and Melissa, who did a great job texting questions my way. Those are our medical students from the Texas Tech Paulo Foster School of Medicine.
Great job.
You guys make my life so much easier. Thank you so much. And again, I want to say thank you to Tenet Healthcare, and again, that's the Hospitals of Providence, for underwriting this program tonight, and also for putting into place and educating us on what's going on in the hospital systems with COVID happening. And again, I'm looking at it as two different things, but also there are other ways and other things you need to take care of. Thank you so much for watching. This has been the El Paso Physician. Good night.
Good night.
% online degree programs offer the same excellent education online as you'd receive on campus. Our goal is to provide you with access to a great education no matter where you are or what you do. Our online format is flexible and convenient